Medicare Advantage plan, there's no telling where it can take you. That's because with a Medicare Advantage plan, you get more benefits and more coverage than with original Medicare alone.
Are you like me and completely sick and tired of hearing all the Medicare marketing, especially when most of it is lies? It's the same thing as Part A and the same thing as Part B, and you've got freedom of choice to go where you want to go. What a crock. Hi, I'm Christopher Westfall. I've been doing Medicare insurance now for 28 years or 29, something like that. Anyway, today we're going to go over the new numbers that just came out for 2026. What's changed and how significant is it? We will find out today. Now, the different parts of Medicare will affect you depending on which kind of plan that you have. If, for instance, you have a Medicare Advantage plan, then you're on the plan that they decide that you're going to be on, and it changes every single year. What I mean by that is your hospital costs will change, your doctor costs will change depending on if and when it's in the network or not, or if the doctor left the network. What I mean is your copays are fluid. They could change a lot. And that matters a lot because it doesn't matter what they say that the costs are on Part A or Part B of Medicare. What matters on your Medicare Advantage plan is exactly what's in your summary of benefits and whether or not your providers will ever change or leave your network during the plan year. But if you're on original Medicare, got good news for you. If you have a Medicare supplement, almost none of what I'm about to cover applies to you. Your Medicare supplement does not change. Medigap plan, otherwise known as like Plan F, Plan G, and Plan N, you don't have to touch that, don't have to do a thing with it, especially during this enrollment period. It is a good idea to check your rates, especially when you get a rate increase, and see what else is available. But during this election period, this is primarily just for Medicare Advantage and Part D drug plans. So before we start, here's an important question. If your medical usage during the year increases drastically, let's say in March, April, May of 2026, do you know exactly how much that's going to impact you before Medicare picks it up? And if your current plan isn't going to protect your wallet next year if things go bad. You know, the whole purpose of insurance is to protect us when unforeseen things happen. So today we're going to look at the cost. We're going to look at how it will affect you or how it won't affect you depending on what plan you're on. If you have no plan whatsoever and a significant number of people don't have a plan, this is particularly for you. Let's start with Part A of Medicare. Part A covers you when you're in the hospital. It also covers hospice. But if you're going in the hospital, your benefit period deductible will increase from $1,676 per benefit period. Typically, it's just 60 days in there. It'll go up to $1,736. That's if you walk in the door in the hospital and you have neither a supplement or a Medicare Advantage plan. Remember, I told you if you're on a supplement, this isn't going to impact you because the supplements that I mentioned, Plan F, Plan G, and Plan N, the most common ones sold or bought, those plans cover the Part A deductible walking into the hospital 100%, so it doesn't matter to you. But again, if you don't have any plan at all, your daily coinsurance, this is a daily cost, if you're in the hospital for days 61 through 90, will rise from $419 per day to $434. Skilled nursing for days 21 through 100 will go up from $209.50 to $217 again per day. Now, skilled nursing is one of those important things that we often don't think about when we're talking about a Medicare plan. And it's important that we do because here's the deal. If you're on Medicare Advantage and you want to go to skilled nursing, or you have to, let's say you break your leg, you fall, you break your hip, and you have to go to skilled nursing before you're allowed to go back home, it is that is the biggest crux, the biggest problem of Medicare Advantage. Why? Because they have an algorithm that determines, based on your age and your frailty and your medical records, how long you should be able to stay in skilled nursing. It has nothing to do with your particular medical record. And I know I'm getting off track here. I'll get right back on it. We've covered this in the past. Look at the head of our YouTube channel, the top of the YouTube channel, where it's got the Senate hearings on this. You'll see many experts from around the country that testify. They are the ones that are advocating for seniors. And this is the biggest problem, skilled nursing. Because while the benefits say they're the same as original Medicare, on Medicare Advantage, that's not the case.
If a senior has original or traditional Medicare, they can expect to receive up to 100 days of coverage for their stay with no hassle. If a senior has a Medicare Advantage plan, however, they can expect to receive a denial well before their doctors even say they're ready to go home. Now, these are not uninsured individuals. These are individuals who have chosen and paid for a Medicare product that was heavily marketed and aggressively sold to them. They're not getting the coverage that they paid for, and they're met with hurdles at every turn.
This is the biggest reason for claim denials in Medicare Advantage is this right here, skilled nursing. But again, if you have no plan, your cost per day past the first 20 days is going to go up to $217 for 2026. Now, for people who do not qualify for premium-free Part A, and most people have worked 40 quarters, that's 4 of them in a year. Most people have worked 10 years, and so their Part A cost is negligible, is nothing at all. But those people who have not, if you get partial credit, it's going to cost you $311 just for the Part A if you didn't work the full thing. If you haven't worked anything and you're eligible to get Part A, a lot of people that move to the United States, it's going to cost you $565 per month just for Part A. Now, Part B of Medicare, what is Part B? That's the cost that most people are impacted by. Part B is everything outpatient. And the standard monthly premium is going to rise from $185 a month to $202.90. This is the biggest impact. It's almost 10%. And the yearly deductible, this applies to either no plan at all, or if you have original Medicare by itself, or if you have a supplement, G or N. Now remember, if you have Medicare supplement G or N, you have to meet the Part B deductible every year. And this year it's going to hit $283, up from $257. Now, what that means is when you go to the doctor, you're going to have to pay it the first part of the year. And everybody forgets this on a Medicare supplement, whether you have a G or an N plan. The first part of the doctor costs, anything outpatient, is going to be borne by you. However, important to remember that Medicare is first going to reprice it. So again, if your doctor says this is a $400 claim, Medicare says, no, we only pay $100 for that. You'll have to pay that first $100 after it's been repriced by Medicare. Important to remember that until you've reached your deductible period for the entire year. And again, for 2026, it's $283. Now, there's a small special note, new law that says for kidney transplant patients who are taking immunosuppressant drugs, their premium for that is going to be capped at $121.60. That's a good thing. So it's important to find out where Part B is funded from. And a lot of people don't know this. We hear this a lot in the comments on YouTube that I'll try to respond to. Thanks for engaging. Part B is funded mostly through federal revenue, and that's payroll taxes and the like from the federal trust fund that's supposed to be locked away for Medicare. Only 25% of the premium comes from you having to pay into it right now. And I know a lot of people say you shouldn't have to pay anything into it once you're eligible for Medicare, but I wanted you to know that 75% of Part B and all of Part A, if you qualify, is still borne by the taxpayer. Just important to know that. Now, also, higher income households will have to pay more and even more. If you want to see those IRMA guidelines, we have them for you, or you can just Google search what it is. That's the income-related adjustment amount. That impacts people who 2 years ago, because they look back 2 years ago on your tax return, were over a certain income amount, you will have to pay more. And again, a lot of people are commenting all the time like, why don't the rich have to pay more? They do, both on Part B and the drug plan, Part D. It's an extra bit for those people who have more. Now, a large part of spending growth in this, and the reason the costs are going up, is advanced wound care that's taking care of things like skin grafts. And they're often used for long-term wounds such as diabetic ulcers and venous leg ulcers. Now, Medicare reviewed this category, and this was going to be a huge part of the increase in the cost on Part B, but they've strengthened the Medicare necessity rules, medical necessity rules, on when these products are now paid. So this adjustment is estimated to lower the spending by nearly 90%. Here's some background on that. In 2019, this cost was $900,000 per year to Medicare. In 2025, it was $10 billion just for the wound care. It is rife with fraud, and it's one of those things that Medicare has just proposed for 2026 in those very few states, I think it's 5 states, where they're going to have prior authorization required because it is just rife with fraud. But now that they put these new rules in place, they're thinking they could bring it back down to 2019 levels, and that means a reduction in what the cost of Part B otherwise would have gone up to. So that's a good thing. So let's talk about Medicare, prescription drugs and the like. So Medicare has an out-of-pocket limit. Every year that out-of-pocket limit, on Medicare Advantage, has an out-of-pocket limit where the companies are allowed to charge you a maximum out of pocket depending on what your costs are. And it's important to remember, and if I'd let that commercial go when I was shaving today, it talks about your covered cost. There's a cap on your covered cost. Well, that's true. However, the big catch with Medicare Advantage is it covered? Because if you get treatment that's not covered, sorry, your max out-of-pocket does not apply to you. But it's important to understand that your max out-of-pocket for 2026, the most they could have it set at on your plan is now $9,250. $9,250. Now, most plans don't have that. The average, as a matter of fact, is $5,900, but it could be that. And if you have a out-of-pocket option where you can go out of the network option, inside the network or out, a PPO plan, it could be as high as $14,750. Now, what happened with me and my grandmother's situation is she had cancer, diagnosed with cancer on a Medicare Advantage plan, went into the hospital in the last quarter of the year, hit her max out of pocket. I think back then it was only $3,500. The catch is when she went back to the hospital after that, the next year, had to be readmitted for something, that's when it got her, because you have to hit that max out of pocket every calendar year, and that can be a stinker. So if I were you, I would make sure that you have in a cookie jar somewhere the max out of pocket that you're ready for. And if you've not yet looked at what you could get, like a hospital indemnity plan, especially with a Medicare Advantage plan, you need that because they can be as high as $500 or $750 per day that you go in the hospital on those plans until you hit your max out of pocket. Consider a hospital indemnity plan, and we can help you with that. The other thing you should consider is a cancer plan, because on Medicare Advantage, you will absolutely hit your max out of pocket if you have cancer of any kind. And that's if everything that they diagnose for you and give you as far as treatment is covered. Now, things like MD Anderson, Sloan Kettering, Mayo Clinic, we've already found out this year, those things are not going to be covered if you have a Medicare Advantage plan. That's just a foregone conclusion. However, if you had another $50,000 sitting around, I'm just saying, that's what the cancer plans pay for, then you could go there, you could get the treatment, and you don't have to be told no by your oftentimes zero monthly premium Medicare Advantage plan. Just keep that in mind. Those are two things that you really should have if you have a Medicare Advantage plan. So going forward, the Part B premium increase adds about $18 per month for people that are on Medicare of any kind, whether you're doing Medicare Advantage or you're doing a Medicare supplement. Both of you have to pay for Part B. The ironic part is, if you have Part B and you're paying for it, if you're on a Medicare Advantage plan, you don't have the benefit of what original Part B is, and that is going to any doctor in the country that accepts Medicare. You still have to pay for that, but actually behind the scenes, your money for Part B is routed to the Medicare Advantage plan, along with a lot of money from the government on your behalf. And that's why a lot of people are asking, why? Why do I have to pay for Part B if I can't even use it? If I had real Part B on original Medicare, even a supplement, I could go anywhere. It's one of those weird things about Medicare. So how's this going to impact your budget? You really need to look. A lot of people, and I see this every stinking year, they don't look at the summary of benefit changes that are going on with Medicare, especially the Medicare Advantage plans, because those benefits are going to change in most every case, especially, the last 2 years of the Biden administration, they reduced the payment to Medicare Advantage plans. So the plans started cutting back their benefits, started cutting them back. And then in 2024, 2025, the utilization went up, which means a lot more people are using those plans, at least according to the insurance companies. So what did they do? They kept the majority of the plans at zero premium, so it looks really, really attractive. What you didn't notice if you didn't look is they took a lot of the benefits away, those extra perks that they used to have in Medicare Advantage plans to try to lure you in with all the money coming from the government. When those benefits went away, also the costs went up on the things that you have to do daily, like you're paying for your drugs. Those copays went up to accommodate the fact that in 2026, your max out of pocket on the drug plans, it's going to be $2,100. That sounds like a great thing, right? And it would be a great thing if all the drugs were covered. One little trick that they're doing this year is they're taking a lot of those drugs that were on the formulary, that's the list of drugs that are covered, and they're putting those drugs in a higher tier or removing them altogether. So your monthly premium, the average across the country, has actually gone down the monthly premium for a standalone Part D plan. And the max out-of-pocket is there. You won't pay more than $2,100 for covered drugs. It's, again, that small print of the word covered that'll actually bite you. So what can you do? You've got to stay informed. If you've not yet done so and you're on a Medicare Advantage plan, please, for the love of all is holy, look at your summary of benefits, because we're going to get thousands of calls. We get it every single year when people say, I didn't know this was going to change. I didn't know this was going to change on my Medicare Advantage plan. It's the same plan. It's the same plan number. Everything looks exactly the same. Right. And that's why I'm asking you now, please share this information with anybody that's on Medicare and considering or already on a Medicare Advantage plan, because you have to know the detail, the devil's in the details. And that's what's changing so much this year. We've already covered where 33 major hospital networks are pulling out altogether, or a majority of which they're not going to take any Medicare Advantage plans for next year. So it's on both the provider side and on the small copay side, especially when you're looking at what does it cost to go into the hospital. And just do me a favor, if you don't believe me what I told you about cancer plans, just look at what your plan on your Medicare Advantage will cover with regard to cancer. Because you'll be surprised to know in most all cases that it means that you have to pay 20% of all the cancer treatment costs. Well, let's back up again. If you had no Medicare whatsoever, and you just had no Medicare Advantage plan, like a supplement or an Advantage plan, you only had original Medicare, and you said, forget all this insurance, it's all a scam, I'm not going to do any insurance at all. And you go into the doctor, and you have that Part B cost of what's going to cost you right out of your pocket. You have the Medicare deductible, then you pay 20% of all your costs. And again, on original Medicare, there is no max out of pocket. You're going to have to pay 20% of all your chemotherapy, all your advanced drugs, all your recovery drug, everything that's going to be administered by Part B, all the infusions, all the IVs, all the treatments. You're going to have to pay 20% of that out of pocket with no cap. Well, guess what? If you're on a Medicare Advantage plan where they're getting thousands of dollars per month from the government to take over your care with Medicare Advantage, guess how much you have to pay on your cancer treatment? Ironically, the exact same thing. That's right. If you had no plan, you pay 20%, but at least you have the opportunity to go to the Cancer Treatment Centers of America because they'll take your original Medicare. You can go to the Mayo Clinic because you've got original Medicare. You can go to Johns Hopkins. You can go anywhere you want to with original Medicare. You give up that right with a Medicare Advantage plan, but in both cases, you'll have to pay 20% of your cost for cancer. So don't say that I didn't tell you. If you call us next year, which some people will do, and they'll say, I was on this plan because it was so inexpensive. I got the Medicare Advantage plan because it was zero premium. And I had no idea what would happen when the worst hit me. So at least you know that the biggest thing that we see when we have this experience, and it's just, it really eats at your brain. I'll tell you, when I was in law enforcement, the worst thing that I experienced was seeing kids as victims of homicide and abuse. That's the worst thing, and that'll live with you forever. If you just saw 2 of those in an entire career, that will stay with you. But I've heard vicariously through the clients in all 50 states in these last 28 years, so many horrendous stories of care that's been denied. And they've always had this statement that justice delayed is justice denied. That could not be more true than healthcare. Because if your healthcare is denied, and then you have to appeal, and you appeal, and you appeal. Most Medicare Advantage salespeople will say, that's okay. If it's denied, just simply appeal. Well, picture this. Put yourself in that position. If you have agonizing bone cancer and it's eating at you, and they tell you you can't go to the best oncologist in your county or in your state, or the Cancer Treatment Centers of America, or Johns Hopkins, who has the latest research on treating your specific kind of cancer. No, you just simply can't go. What does that mean? It means while you appeal and you try to get an exception and you try to get things approved, your cancer increases and it increases. And I'm not just telling you this as some goofy metaphorical possibility. I'm telling you, I've heard these stories so many times. It literally eats at you. This is the kind of thing that keeps me up at night. And I don't understand for the life of me the agents who present to you no other solution. And I'm not talking about when it's an appropriate solution because your budget won't allow you to get a Medicare supplement plan. I'm talking about the agents who bank their whole careers on making the most money possible when you're turning 65, because they're going to make $600, $700, $800 on signing you up for a Medicare Advantage plan, and you never hear from them again. How do they sleep at night when they tell you that this is the best possible thing for you and never give you the choice of telling you what's on the other side? If you haven't opened your Medicare and You guidebook, it'll tell you now, almost completely unbiased. In years past, it was really horrible. It will tell you now you could do original Medicare with the freedom and flexibility to go anywhere you want to for treatment. Or you can do Medicare Advantage. Just keep in mind, if you're signing up for Medicare, turning 65, and you're brand new to Medicare, you have these two choices before you. And if you choose the road less traveled, that's the one that's going to cost you a monthly premium. But you'll always know you could give up that plan if you want to. But if you do, if you forego your first opportunity to get on a Medicare supplement plan, you may never, and you'll only find out when it's too late. This is not hyperbole. This is not a sales pitch. I'm just letting you know. If you don't trust me on that, read it in the Medicare and You guidebook. If you don't get a Medicare supplement or Medigap plan when you're healthy or when you're new to Medicare, you may never be able to get that plan again. I'm going to tell you a loophole here that's going to get me in trouble. And you know what? I don't care. Here's the deal. Let me give you a hypothetical scenario. Let's say you're on a Medicare Advantage plan and you come down with cancer and you go to your local primary care doctor because you have to on a Medicare Advantage HMO plan. And your primary care doctor sets you up with an oncologist, the cheapest the company could find, because they're accepting your Medicare Advantage plan. The oncologist says, you know what? You really need advanced treatment. The best person for your treatment is this doctor over here in this county. But by golly, it's not accepted. You call that doctor, and the doctor's first thing out of their mouth when you call them is, what kind of insurance do you have? That's the first thing they're going to ask you. And if you say, I have X Medicare Advantage plan, the worst thing you can possibly hear that'll make your stomach sink is, we don't accept that plan. We're not part of their network. So here's something that I saw somebody one time hypothetically do. And so I'll share with you what worked for them. And maybe you'll know somebody in your Medicare career that this would be good for, and this would help them. Here it is. If you find out that financially or emotional support needed, you change your address and you move in with a relative that's in another state. You notify Medicare, you notify Social Security, you're changing your address, and you notify your health plan. They will send you a letter that says, you are no longer going to be in our service area. Now, you can do this a month before you move, and you can do it a month after you move. Doesn't matter. When you change your address, you're going to get a letter that says, you are no longer in the service area. You can use this letter to go to another Medicare Advantage plan, and if it's a national carrier, they'll try to keep you with their plan naturally. But they can't just do it. They can't crosswalk you over into another plan, is what they call it. No, you have to affirmatively sign up for that other Medicare Advantage plan, or you could get a guarantee issue Medicare supplement plan, bypassing all underwriting rules. Now, it's not going to be cheap because you can't get Plan N, which is the most affordable Medicare supplement you can get, and the lowest rate increases usually. You'll have to get a Plan G if you were eligible for Medicare after January 1 of 2020. Or if you were eligible for Medicare before January 1 of 2020, your guarantee issue go-to plan is Plan F. So it's not going to be cheap. However, you then get an opportunity, if you get that guarantee issue plan, to get on a drug plan too, a Part D drug plan. You get essentially a do-over. Getting this do-over means you get to go to any doctor and any hospital to treat that disease because you simply changed your address out of the service area. Now, the last time I looked, we live in a free country, and you can change your address. You can decide to move. You can change your mind from moving. You can move back as many times as you want to. The law simply says, if your address with the plan changes to outside the service area, you get a guarantee issue Medicare supplement plan. Just keep that in the back of your mind in case you have to move in with a relative and you need help. And you have to move there for financial reasons or emotional support reasons or just somebody to get you to the doctor or not. Keep that in mind. So if we can help you with anything, our contact information is seniorsavingsnetwork.org, or you can call our 800 number. It's 800-729-2828. 9590. We're completely unbiased. You can go to any plan you want to. We're just going to give you honest, free advice on what may be best suited for you depending on your specific situation. We won't tell you Medicare Advantage plans we can't help with, because we can. We certify with them every single year. We are selective on which plans we choose to represent. We won't represent plans that do horrible things to people. We just won't. So if you need an unbiased guide, remember that if you're choosing Medicare Advantage, you have a deadline of December 7th, unless you're moving out of your service area or you're brand new to Medicare. God bless you. Stay tuned. We have some exciting things coming that may benefit people on Medicare. So please stay tuned. Thanks for watching. Bye-bye.